Hi, I'm Dr. Kurt Wohler for Autism Recovery System. I want to talk to you about a case of an autistic child with fecal smearing. So fecal smearing is a very significant, severe behavioral problem. And this case comes from my practice from a number of years ago. Now, this is not to indicate that all cases of fecal smearing in a child with autism are exactly like this. But I have seen this scenario play out a number of times over the years in my practice. When I practiced in Southern California, there were certain times of the year where the desert winds blew from the deserts in Southern California and blew westward towards the Pacific Ocean. These were called Santa Anas, and this is where the temperature rises. You get these currents of air that are blowing east to west, and with it they bring a lot of pollen and other debris in the air as well. So a lot of people get allergies and itchy eyes, etc. It's also a vulnerable time in Southern California for wildfires. In this particular time, a Santa Ana started to blow, and there were fires that caught in the eastern mountains of San Diego County. And so as the winds were blowing towards the Pacific Ocean, it brought this firestorm with it. There was a family that I was working with who had a fairly severe autistic child. And this child had a lot of problems with candida symptoms. And so we know a lot of the candida symptoms can, cause things like inappropriate laughter, goofiness, giddiness, silliness, this drunken behavior that many of these kids get. And he was fairly well controlled on diet and supplements that helped to control candida. Well, this storm comes sort of ripping through San Diego County, and this family actually happened to live downwind towards the coast. And about 2 days into the fire, and about 2 days of this family being exposed to a lot of this smoke, I got a notice from the family that their child was having severe, what appeared to be candida yeast-related symptoms. But there was also this behavior of fecal smearing. This child started smearing feces not only in the bathroom but in his bedroom. And this is not something that he had done before. He had certainly had a lot of yeast symptoms, but this was a new manifestation. So I knew about his history of yeast-related problems, and with the acute onset, how quickly this thing manifested, I had a sense that this child was dealing with some sort of severe exacerbation of his underlying candida problem. Now, I knew that I could have run a test, done something like an organic acid test, but the problem is it could take a week to a week and a half to get the results back, and clearly fecal smearing is a very non-desirous type of behavior to try to deal with. So I decided to treat him for candida. Now, granted, they were already on botanicals, and like a lot of families, they had things like grapefruit seed extract and other types of remedies that can be helpful for candida. But I wanted to use something that was quick enough acting and powerful enough to see if it would make a difference in this behavior. And so what I did, prescribed diflucan. Diflucan, also called fluconazole, is a systemic antifungal similar to other things like Sporanox and Lamisil. I could have used nystatin. Nystatin is also a prescription antifungal, but it tends to have more of a localized effect in the digestive system, and it's not as quick acting for more severe cases of candida as I felt that this might be. So I chose the diflucan. And what happened in this particular case is about 2 days into using the diflucan, his yeast behaviors decreased significantly. Within about 3 days, the fecal smearing stopped. Now, luckily, by this time, the fires had also died down, the smoke cleared, the skies cleared up, and it was no longer a problem. So I was pretty confident, clearly, that the diflucan, it was a stopgap situation to just sort of decrease his body's reaction to an exacerbation of candida. It's often been wondered why this happens. we sometimes see an uptick in candida symptoms with allergy season. Okay, so it could just be high pollen counts in the air, and certainly it can be different depending on what part of the country or what part of the world you live. And so different seasons can sometimes trigger this. I have seen this play out in a few other cases as well, not with the forest fire scenario, but high allergy seasons. In fact, when I worked in Southern California, I could almost predict when we started getting the Santa Ana winds that were blowing from the deserts towards the Pacific Ocean, that I was going to start getting phone calls that children were now having exacerbations of underlying yeast. And I was usually, pretty right on with that. And actually they would occur about 4 times a year, which is pretty typical of Southern California. So just something to consider with your child if you see this type of acute exacerbation, or particularly this fecal smearing in association with yeast behavior as well. Now, the organic acid test from Great Plains Laboratory is a great test to detect underlying toxicity related to Candida. I have many other videos on this topic, as well as in the autismrecoverysystem.com site. There's an entire biomedical course where we go through the interpretation of the organic acid test, Candida treatments, etc. Now, there's a website, labtestplus.com. This website holds a number of tests from Great Plains Labs, as well as other lab testing as well. So this is an area that people can access this testing. And when labs are ordered through Lab Test Plus, each test comes with an individualized written interpretation of findings, as well as action steps, suggestions based on the information that the test is providing as well. So you can go to labtestplus.com and look at the menu of tests. I'm Dr. Kurt Wohler for autismrecoverysystem.com. Thank you so much.